Welcome. Hello, friends. Welcome to my channel, The Ready Nurse Nay. Guess what? I passed the NCLEX. Woo! I passed the NGN Next Generation NCLEX, and I am officially a registered nurse with a chill, real deal license. How do I feel? It feels surreal. It took me, I don't know if you've been following along, it's taken me 7 years to finish nursing school just because of life and unexpected, trials and things. And yeah, it took me a long time, but I'm finally here. I definitely got to a point in my journey where I didn't know if I was gonna make it, but you know what? I did. I graduated nursing school, even though it took me a while. I took the NGN-NCLEX and I passed on February 1st, 2024. I became a registered nurse. So I'm really excited. I would say congratulations to all of you who are taking this test and passing it. Congratulations. It's due to you. And if you're having some trouble with it, reach out to all those additional resources that are available to you through those test prep sites and different mentors and things like that you can reach out to. Utilize those platforms and utilize those people to help you with the test if you need it. So I'm basically just gonna kind of give you, this is a quick video just giving you some I guess tips on the test, what to expect, my experience with it, and any advice I may have. So if that's something that you're interested in, keep watching until the end, and then drop some comments, comment, subscribe at the bottom as well throughout the video or at the end, whatever. All that stuff is appreciated. Much love. Okay, so first thing, the first I guess tip that I would give when it comes to the NCLEX is to know that it's different from the traditional NCLEX. It's different. In the traditional NCLEX, I think it's 2020, the year 2022 and prior, their test is different from if you're testing in 2020, if you've tested in 2023 and beyond. So I tested 2024. 2023 and beyond, you're taking that NGN test, and it's different from all those people that took their NCLEX from 2022 and beyond. So your experiences are going to be a little different. The test is different, so know that. And because it's different, you kind of need to know what you're working with. So my advice is to actually know the basic format of the test. So the basic format of the NGN-NCLEX, it's going to be the minimum amount of questions that you will have is 85, and the max amount that you can have, let me look on here, I think it's saying a max of 150. So I don't know. Look that up just to be sure if that's wrong or whatever. But so the minimum amount that you can have on the NGN text is 85, and the max amount is, I think, 150. And then within that, the first 15 questions are thrown out. They're thrown out. So you can pass by answering between 70 and 135 questions. That's what's going to be scored. But the minimum amount of questions you can have is 85. Max amount is up to 150. Okay, cool. You can get up to 5 hours to take the test. You have 5 hours to take the test. And then depending on your testing facility, you get breaks. So at the testing facility that I was at, we got 2 breaks. 2 breaks, and then you can take as long as you want, honestly, on those breaks. So for my test, I passed in 85 questions, and I only took 1 break. I only took 1 break. Sometimes people like to rush and get through. They don't want to take breaks. But if you're a person where you need to take a break if you need it. I took a break, took a bathroom break. I took about 5 or 6 minutes. I ate a snack, drank water, looked out the window. Taking a break kind of helps to give your brain a little break and a breather, because it's a lot of questions. 85 is still a lot of questions. Okay, so that's my first tip. Know how the test is formatted. It's also called, CAT testing. That's short for computer adaptive testing. So the way the test is made, no 2 individuals will have the same test. We all will have different tests. And it's based off of kind of your knowledge and what you know. So as you're answering these questions, it's going to kind of adapt to how you're answering the questions. What you're answering wrong, you're going to get more of that question. What you're answering right, you're going to get harder questions based off of what you're answering right. So it's computer adaptive testing. I would encourage you to go to the NCSBN website, or even kind of Google and look up computer adaptive testing to kind of get a better format of how that is utilized in the NCLEX. To pass this test, you do not need to know everything. You don't need to know everything. It's just impossible. Things are changing. You don't need to know everything. And the makers of this test know that you're a new grad and you don't know everything. So I guess I want you to think about, you don't need to know everything. But what this test is testing is if you are a safe nurse and you won't kill a patient. So, boom. And then the whole process, just to know in your head, the whole process of nursing school, you know, is basically and should basically be to teach you how to be a safe nurse, how to practice these skills safely on patients, keep your patients alive, ask for help if you need help. And then all of that, everything that you're learning in nursing school is going to help you to be a safe nurse. And then it's also going to prepare you and help you to take the test as well. Okay, so your nursing school education, I guess that's the third point, is your nursing school education is useful with you passing this test. It's useful. Your nursing school education is useful with you passing your test because it's teaching you content and how to be a safe nurse. And you need to know the content and how to be a safe nurse in order to pass this test. I think things that will cause a person off the bat to fail the NCLEX is if you do not know content. And also, if you don't know content, if you're not managing like your anxiety during the test, getting super nervous and just picking anything, not critically thinking, and if you're just not a safe nurse, you're guessing. If you're guessing and stuff like that, you don't know. I think that those are 3 things that will really cause you to like fail the test. Because that's showing you're not a safe nurse. If you don't know content, general disease process of how it's affecting the body and things, if you don't know, if you're just picking whatever and you're guessing and you don't even know, that's showing you're not a safe nurse. Because if you do that on an actual patient, you could kill a patient. If you don't know what's going on, you're just guessing, you can kill a patient. If you do that on NCLEX, you can fail your test. Don't guess. You need to know. Or don't pick that answer. Or critically think to kind of process of eliminate down and pick the best answer. But if you get to a point where you have really bad testing anxiety and it frazzles your critical thinking and you're just picking whatever, you don't want that to like interfere with your testing. So you have to manage that. And however you got to manage that. Okay. For the case studies, I would say for the test is like half traditional questions where, you know, you read the question and you pick 1 through 4 out the answer. You pick the correct answer. And half is NGN, which are those case study questions. So you get 1 question, and that 1 question has, well, that 1 case study has 6 questions with 6 questions that are attached to it. So the big thing with the case study questions, you need to read the whole case study. Read the whole case study, and a lot of testing centers may give you a pen and paper or a whiteboard or something to write down. Write down the key symptoms or whatever that patient is displaying. Any, you know, symptoms or something like that out of the ordinary. Write those things down, and that will help you to kind of identify, okay, this is going on with this patient. They're short of breath. They have altered level of consciousness. You know, they didn't take their medication this morning. It kind of clues you in and will help you to answer those questions. Also, what a strategy that I use when I saw a case study, a long case study, because they can be long. They can be long on this test and kind of annoying. What I would do, I would read the question first. And then, so I kind of knew what was going on. Then I would read through the case study. That's kind of how I did it. So, and read all of your answers. You don't want to miss something because you skimmed over the answer. So read your full case study, read your full questions, read your full answers. What else I have on there? Okay, testing strategies. Any type of testing strategies that you can utilize on this test, I would say use it. So like process of elimination, that's a testing strategy. Like if you get on the question, you're like, I don't know what this is. You use your process of elimination where you go through each one and you're like, okay, it can't be this one because of whatever. It can't be this one because of whatever. So now I got 2 answers left. Which one is most likely the right answer? And then you kind of process of eliminate. Okay, it can't be this one, so it's probably most likely this one. The opposites can't be true. It's going to be one or the other. So like if you have a question and it's asking, I don't know, I can't think of something, but it's asking a question. You have 4 answer choices, and the answers are hyperkalemia, which is, you know, high potassium, hypokalemia, which is low potassium, and then like hypercalcemia, high calcium blood levels, or hypocalcemia. You know, it can't be, the opposites can't be true. You can't have high potassium blood levels and low potassium blood levels at the same time. It's going to be one or the other. So your opposites, they can't be true at the same time. So like those kind of, I don't know if I'm explaining that well, but though, like, that helps you kind of answer question choices and kind of narrow things down. Things like that. Another test strategy on this test, with this test, I think is a benefit. Back in the 2022 and prior, they didn't receive partial credit for select alls. I don't think they did. They had to get them all right, or I didn't get it right at all. But for the NGN, you get partial credit for your select alls, and you get partial credit for your case study questions if you answer it wrong, pick wrong answers. So the way it works, you can look all this up on the NCSBN website, or kind of Google and just do a deep dive on how the NCLEX test is set up to learn more. But the way it works, if you have a select all that apply question or a case study question that has select all that apply, every correct answer choice that you choose, you get +1 point. Every incorrect answer choice you choose, you get -1 point. So if you want to maximize your points, the best thing for you to do would be to only pick the answers in select all that applies, and only pick the answers that you are sure about, because you will get points for those. If you pick an answer that you're kind of really unsure about, you're going to lose points and almost ultimately kind of lose the points for that question, if that makes sense. Because you have +1 for the correct one, -1 for the wrong one. That's just 0 for that question. Versus just having at least a +1 for that question. You know what I'm saying? Another thing I would say isn't really important is to take your time. You got 5 hours. You do not have to rush. You can still pass you got 5 hours. And also, don't worry about how many questions. It may have taken me 85. It may take other people 85. It could take 100. I don't know. However many questions, just take your time. Do not freak out if you have more than 85 questions. That does not mean you failed. It just doesn't. You might have to take a few more questions for them to realize you're a safe nurse. So don't freak out if it goes past 85. Also, take your time. You have 5 hours. Don't rush. Take your time. Don't freak out if it goes past 85 questions. And then manage your anxiety. Manage your anxiety during the test. It's a big test. You have went to nursing school all these years to prepare for this test. The test itself is kind of expensive, so it's like a big deal. And then not only that, the testing centers are so serious. There's, they're doing palm scans to verify your identity. You have to check in, check out. Like, there's cameras everywhere. Okay. It's like lockdown in there. Okay. They're making sure nobody's cheating. Okay. It's very secure. And so you feel the pressure, and then you're in the room with all these individuals taking other tests as well. So it's a, serious business, but you have to manage your anxiety. So I know when I first got in the test room, I was a little bit nervous, right? I don't know why. I was just nervous. And when you're nervous or something, or scared or fearful or angry, you cannot think straight. You can't think straight. So to calm myself down, I definitely took deep breaths. Not loud like that, but I took deep breaths throughout the test, especially the beginning part, because I was nervous. I didn't know what to expect. I took deep breaths. And so taking deep breaths, you're looking at a screen for a long time, so that can kind of hurt your eyes. So every now and then I would kind of look off the screen and kind of just stare at the wall. We were in cubicles. Stare at the wall in my little cubicle area that I'm taking the test, and then look back. Or look down, just to kind of give my eyes a break, give my brain a break, because it's a long test. 85 questions is a long test. That's long. So those different ways to manage your anxiety. And then as I kind of got going in the test, my confidence picked up, and I was like, okay, cool. But man, when I hit 70, my brain, honestly, when I hit 60, my brain was tired and I needed a break. I pushed to about 70, and then I was like, okay, I need a break. So I took a break, and I, took like a 5 or 6 minute break. I went to the bathroom. I kind of just dilly-dallied a little bit. I looked out the window, ate some snacks, did some cool breaths, and then I went back in and finished the rest of the 15 questions that, before I passed or whatever. We'll have maybe write on a sticky note or something the actual address and location of your testing site, and just stick it in your car. I actually went to the wrong testing site, y'all. I went to the wrong testing site. It was a prior testing site that was shut down, and I went there and I was knocking on the door and it was closed. So I'm so glad I went early. Then I had to call my friend. I was like, where am I supposed to go? And she was like, you're at the wrong place. GPS, thank God for GPS, and I ended up, going to the right place. But that could be avoided if you just maybe write down the address of your testing location and just stick it in your car. Right? Bring some snacks. You don't have to bring water. Most times they provide water, but you can bring it, if you want. But definitely bring some snacks. And overall, my experience with the test was positive. It was positive. It wasn't bad. Like it wasn't like terrible. It wasn't bad. I think for new nurses, or maybe if you're a nursing student, my advice would be to, if you're watching this and you're in nursing school, my advice to you would be to, when you start in fundamentals all the way to your last semester, just do your best in nursing school, do your best in clinicals, do your best in your classes, pass your tests, and that information is going to help you with being a safe nurse, but also will help you with passing your NGN-NCLEX. So really working hard in nursing school, doing well in nursing school, that's going to help prepare you for this NCLEX. Yes, and so that is my advice. My advice, if a person did not pass it for whatever reason, they have so many resources available that can help you if you did not pass for whatever reason. Utilize those resources. You are smart, you're intelligent, you can pass it. Go get it, okay? Utilize those resources, man, whatever you got to do. If you got to work part-time, to make sure you pass your NCLEX, if you have to utilize those platforms, if you have to do a live session with an actual person, there are so many resources out there for you. I can't even list them all. I would say do a deep dive. Check out other YouTube videos on it and utilize those resources. You can pass your test. You can pass this test. And that's just, encouragement for those who haven't passed it. Or if you did not pass it, you can pass it. Do what you got to do and get it done. I believe in you. You can totally do it. Congratulations to everybody who needs congratulations. Peace, love, and blessings. See y'all in the next video. Bye.